Councilwoman Henderson, thank you so much for joining us for this much needed discussion about breaking the barrier, breaking the silence, and breaking the behavior panel, as well as you also, Dr. Yan. Thank you so much. And I imagine in DC, it's pretty busy out there.
We had quite the day already, so we're just moving along.
Understood, understood. Well, I know that this discussion really goes in alignment with your own initiatives and your own mission as Councilwoman in DC, especially when it comes to access to quality health care. I know that, part of your platform is addressing the fact that there's high maternal mortality rates in the country and that there's lack of access to just quality health care in minority and underserved communities. So I believe that the mission that Dr. Jan Katsnelson has with Fibroid Fighters and the USA Fibroid Centers is well in alignment with your mission to more access to quality healthcare. So I'd like to just kind of get started with just basically giving an overview of what we're going to be discussing. We want to, of course, cover the access to quality healthcare, and then also mention the potential of educational courses in schools and universities, as well as talking about the health disparities about uterine fibroids. Let's see. So let's go ahead and get started with Councilwoman Henderson. As a policy advocate and mother, what does proper health education and access to useful health education mean to you?
Well, it means so much. And so I think we know, if you look here in the District of Columbia, we actually have really high health insurance rates. I think 96% of our residents have some type of health insurance. And yet, when we look even further in terms of the social determinants of health and the health disparities, we know that insurance is just part of it. Do you have access to care? Do you have access to a doctor when you need to see them? Do you have access to all the other things that go into healthcare in a system, whether it be good environment, great nutrition, good schools, safe housing and neighborhoods? All of that is put together. But for a lot of people, they go to the doctor when something is wrong. And if something is not talked about or not discussed, it's not something that comes up for them, which I feel like is one of the issues we have in terms of the fibroid issue, is that it's often not discussed in communities of color as like a potential issue as it pertains to women until it is a problem. And I feel like we need to be more proactive in informing people in the same way that we tell them, to do the self-care exams in the shower around breast cancer and mammography. What are the other signs and symptoms? But not just that, having the confidence to speak up to your doctor and say, no, something's wrong here.
That is so incredibly true. And Dr. Yan, why do you feel like it's important to bring awareness about health issues and proper health care to schools?
I think health is a part of our life. And it's very important to own this part of your life as your education, the same way your health, and start as early as possible. What's very important about fibroid problem, the commonality. It's very common. It's pandemic. It starts in early age, and it can ruin 25, 30 years, the best years of life. And knowledge that it's abnormal and it's possible to cure this problem and not to suffer, I think will have a long standing consequences for the whole life, socially, physically, mentally. And that's why it's very, very important to start education early and make sure that women are in charge of their body and in charge of their health.
And with that said, Dr. Yan, you specifically want to bring awareness to uterine fibroids in young girls and women between the ages of 16 and 26. Why is that age group so significant and so important to you?
As women prepare towards adult life, and they need to understand how to properly position themselves to take the full opportunity of life from the physical, emotional, mental, and the opportunities So if someone has a unfortunate fibroid disease, which is very common in a Black women between ages 18 and 30, about 26-27% of women suffer from fibroid disease. By age of 35-40, it's 60%, and by age of 50, 80%. So if someone has unfortunate disease, that puts this particular woman in a situation of inequality. She will not be able to be free and happy as someone who's luckier. And what's important about fibroid today, there are ways to remove the disease, cure it without hysterectomy, with a minimal invasive procedures like uterine fibroid embolization that we, for example, do in the office and takes 30-40 minutes.
Mhm.
And after that, kind of restart the life the way without the problem. So talking to a woman early in the school, in the colleges, in the communities, openly, will make sure that this women are happy and they have a full potential in pursuit of happiness, rather than suffering, uncomfortable to speak about this, not having normal social life, normal family life. Fibroids are number one reason for miscarriages and fertility issues. We don't want this. So one thing is an old way. When women suffer for 30 years, because they think the only solution is hysterectomy and they don't want to have a hysterectomy. So they start thinking about something drastic to treat and not to suffer when they're 45, 50.
Right.
But if they would know that there's a solution without hysterectomy, a minimal invasive one, I can assure you everyone can find an hour or two to stop by the clinic, have covered by insurance minimal invasive treatment that done through the wrist or through the groin through the needle, and go home 2 hours later and have a normal life in front of them.
Right.
They just don't know.
Right. And with that said, Dr. Yan, Councilwoman Henderson, hearing how passionately Dr. Yan feels about educating young women early in the game, how can we bring programs like that where women are educated about any potential reproductive health issues like fibroid tumors, and then also being ready to ask their physicians and be open to demanding more answers about treatment options? How can we bring programs like that into the schools and universities to help young women understand and know about this health epidemic?
Yeah, well, I mean, I think it's how do you bring it into the conversations, right? So, for high school age students, in many parts of the country, we definitely have this in the district, they have to go through a health component as part of a graduation requirement. But the question is, what is covered during those health classes? And for the most part, it's sad, but I kind of feel like the curriculum hasn't really been updated since I was in high school many moons ago. So you're only covering the very basics, right? You're trying to tell us about how not to get pregnant, STDs, and those types of things, but we're not really talking about what are some of the other health issues that you could face even at such a young age that can impact some of these other things as well. And then on the college side, I mean, I think it's a similar conversation, especially around college freshmen, because there are parts of the country that aren't having conversations around comprehensive reproductive health. And so, how are we having those conversations with women as they enter into, undergraduate institutions? And I really think it is, connecting with student health centers who are providing, some of this care, so that this is part of the conversation that they're having, with the patients that they're seeing as well. I really think it is around making it more normalized as part of the conversation, in the same manner that we have worked so hard to make reproductive health in general part of the conversation that we have when we're just talking about health.
Absolutely. So with that said, what, I guess maybe from a patient responsibility standpoint, I'm asking this question, but this is actually a question posed to both of you. And Dr. Yan, I'd love for you to answer this first, but what is it that women should know about fibroids and other health disparities when it comes to, I should say, minority women? What are some of the things that would help them to know just kind of from the beginning?
They need to know that painful, prolonged menstrual period is abnormal. Part what women experience can be abnormal. Certain things are normal when it doesn't affect your life, when it lasts 3-4 days, when it's not painful, that you can walk, reasonable, that's something that's normal. But when woman suffers from 7 to 14 days or longer, have a menstrual period, need to run every 30 minutes to the bathroom, or have a spotting in between, or have a frequent urination, and other symptoms that either related to hormonal dysfunction, on this heavy bleeding, or pressure from the size of the fibroids, most probably it's a fibroid disease, fibroid tumor, benign tumor that basically grows inside the uterus and irritates uterus the way that creates all the problem. Now, why is it important to understand that it's abnormal? Because if you think it's normal, you think, okay, if it's normal, nothing can be done about this. If it's abnormal, it stimulates you to look for a solution. If it's abnormal, don't I want to straighten things out or mitigate this? And then you look for solutions, and there's a will, there's a way. And if you look for solution, in the last 20 years, many solutions are coming along that weren't available in all areas of medicine. Fortunately for healthcare, in fibroid, we have a solution called Uterine Fibroid Embolization that started as actually preparation for less bleeding hysterectomy more than 20 years ago. And it appeared to be so good, so no hysterectomy is needed. And this solution is taking a catheter through a 1 millimeter needle hole, and this catheter delivers to the artery that feeds the fibroids embolization material, basically clog the arteries. If no nutrition to fibroids, they collapse and disappear. That's basically how things work. And when they collapse, they get absorbed by the body. And with the decrease of fibroid, symptoms go away. So symptoms like heavy bleeding basically goes away they go away right away. And the symptoms from pain and heaviness go away very, very quickly. This is a fantastic thing, and like many areas of medicine, we need to be informed what's available. I want to share the secret. Don't tell anyone. Doctors are people too. When they finished medical school 20, 30 years ago, and if they weren't exposed to this, it is very possible they're not aware. It's okay. It's okay to ask doctors about things that you discover. And I think it's very, very important, not just health education to in school and university, everywhere. And to the doctors too, not just to women, but men too. Everyone needs to know. Everyone knows about STD. People know and how to prevent. Everyone knows about menstrual period. People need to know how things function, how the body functions, whether you're man or woman. And it's definitely super important to enable and empower a woman to look for solution early on.
Thank you so much for that, Dr. John. And Councilwoman Henderson, I want to pose that same question to you in a more general sense of, like I mentioned, the patient responsibility. Perhaps maybe getting younger women ahead of the game by teaching them how to ask questions of their physician, other ways that we can take responsibility for our health. What are some of those ways that we could do that?
Yeah, well, I think it starts with recognizing and honoring your agency. You have the right to ask physicians questions. you also have the right to seek a second opinion if it is something that you disagree with, right? And I feel like all too often for young women, and in particular women of color, there's this feeling like I can't challenge the doctor on this. And no one's saying getting into some argument with your physician in terms of what the diagnosis is or what they feel like the solution is. But you can always seek a second opinion if it's something that you feel like you're not comfortable with. You have the right to say no. You have the right to say, okay, I'm going to find another physician who I feel like is going to listen to me. Because I also, I think we, Dr. Yan sort of talking about some of these things in terms of like it not being normal. I know plenty of cases of women who have had, heavy menstrual periods, et cetera. They go to a doctor's office and the doctor is basically saying, oh, well, this can happen from time to time. It's fine, or something to that effect. And I think that it's only when, these individuals are willing to say, it's not fine. And I also don't feel like you're listening to me, to go find another opinion from a doctor. And so I think that's probably the biggest piece of the personal responsibility, is knowing that you have agency in how your healthcare is being provided to you. You just have to know the questions to ask, and you have the right to ask questions.
Absolutely. So why do you believe that we classify talking about our medical issues as forbidden topics? Like when we're talking about the uterus and women's reproductive health and miscarriages, things like that. Why do you feel like they're so forbidden?
I mean, I think that's just sort of been the way that it is. And primarily, I would say, is because in some of these conversations, it's men on the other side. No offense, Dr. Yan. But,
I can talk about prostate.
I mean, think back when I was in high school, health class was attached to physical education. Well, who taught PE classes?
Exactly.
It was usually like the football coach or the soccer coach or something to that effect, who was uncomfortable having a conversation with young women, frankly, around menstrual cycles, reproductive health, those kinds of things. You add in the politics of it, I went to high school in Georgia, where there are rules against how much you can even talk about in that regard, right? You can only talk about abstinence. I can't tell you any other of the other pieces. And so it's just been built into the conversations, hush here, hush there. But I would also say it's been built into the conversations in our families as well. We don't talk about histories of breast cancer in our family histories. We don't talk about miscarriages because that's just something let's just talk about the rainbow at the other end, but we don't want to talk about the trauma that it took to get to that part. And I feel like we're doing young women such a disservice by not just being honest about the situation in terms of what's ahead of you. As I had said to you guys in the conversation yesterday, I think it's such a shame that many women don't find out that they have fibroids until they are at and ready to begin a family. And
absolutely.
but why didn't anybody tell me? Why didn't anybody tell me that this wasn't normal back in the day and that I could have done something to prevent it? So as Dr. Yan said, I can go forward with my life in terms of whatever choices that I have available to me. And so I think we just have to break the stigma and really start having these conversations and be frank about it. It doesn't have to be squirmy. It doesn't have to be inappropriate. It is just based in science and health, period.
Absolutely. And you were also, thank you for sharing that. And also you shared with us that was kind of the case with yourself. Once giving birth, finding out some information about yourself, if you don't mind just elaborating on that just a little bit.
Yeah. So I have an almost 2-year-old. So I guess I was pregnant 2 years ago and going through this process and, going for a regular ultrasound. No big deal. And then the technician, I'm losing my words right now, but basically doing a little scan. And she goes, oh, did anybody tell you that you have fibroids? And I was like, oh, I do? Had no idea. I don't have any symptoms that present. I haven't had any abnormal periods or anything to that effect. And it was just sort of like, okay. So, I think that's also part of the education too, is that there are women who have fibroids who don't have symptoms of it. And, there are ways that you can detect whether or not there's something there. But I was in my 30s at that point, and it had never been a conversation that I had with a physician.
Yeah. And now that you know, perhaps if you do experience symptoms later, now you're informed because of the exam that you had and because your physician opened up to you and told you, what you had. After how many exams, women's exams you've had throughout life?
I know, it's kind of crazy because I'm like, but I come to y'all every year. Conversations every year. I mean, I think my situation is a lucky one, and it's a little bit different. But I do feel for women, especially those who they feel like they've done everything right. I went to school, I got my education, I got a good job, I bought a house, I did all of these different things. I'm ready to start my family, and now you're telling me, in my 30s that I can't. Or I have to deal with this other thing before I can go forward. If I even have a physician who tells me that I can resolve the problem without needing a hysterectomy, without losing my ability to even bear children.
Absolutely. Absolutely. Dr. Yan, how do you believe that we can get the conversation started about young women in the community and knowing their options when it comes to their reproductive health? I know we've talked about education being one of the ways that we can open up the conversation to a younger generation of women so that they don't have this issue in some more severe cases later on. But I know that you've also started the Fibroid Fighters organization to assist with that. But what in your vision, what are other ways that we might be able to get women talking?
I think men, women, if there's nothing can be done about the problem, people have a tendency either ignore or kind of just go through this without complaining. Will it help to complain if nothing can be done? So with the fibroid particularly, can be done was hysterectomy. It's disaster.
Mm-hmm.
Can you imagine for a man, if it would be a little prostate, have amputation of something, considered? That would not be a easy option, right? But that's what it was with the hysterectomy and fibroids. Now, the progress brought to different procedures, like a heart surgery or putting stent opening artery without any surgery, right? It's a big difference. But today, most of the heart surgery, open chest, they're not actually happening because 90% of the problem is fixed through tiny percutaneous intervention. The same thing for fibroids. If women would know that there's a solution that alleviate the problem and position them for the best success, physically, mentally, socially, and give a great life, they would talk about this. And I think talking about nothing will not work, but talking about something that will make a difference will be powerful. So I think talking about solution will help uncover the problem, right? People will come out of woods with it. Me too. It happened. My mom, I know the friend, and trust me, this person is a friend. And people will talk, and that because they feel that they not only helping themselves, they will help their friends, that will help the future generations. Of course, nobody wants to talk about sad thing. Nobody wants to talk about lost children. Nobody wants to talk, especially if nothing can be done about this for loved ones. But if talking about this will help to prevent disaster and improve someone's life, I'm sure people will share the stories and start talking about this. And I think, in schools, in colleges, between friends, social media, celebrities. And when July is a month of fibroids. It's wonderful that there's a breast cancer awareness. There's wonderful that there's awareness about prostate cancer and the heart disease, and the smoking is not good, and many other things. But if you compare the toll of fibroid disease, yes, it doesn't really kill per se. So it's not deadly. but it's a social, physical, and other killer that prevents normal life. And it's so common. 40 million women suffer and 10 million severely symptomatic, enough that 500,000 a year decide to do self-amputation, hysterectomy. They sign consent for fibroid disease. That's how bad it is.
Right.
So I think let's just bring this message out. Let's make sure that everyone who knows about the solution for the problem share with everyone they know. And changing curriculum, I'll be so happy and thankful that that would be possible. I'm good at making girls, and I have girls at home, so I'm programming. And no, that's very important. What you said about health education is so true. But if we have a curriculum that will ensure that things are done right, that things are presented right, that girls' self-esteem will improve. If in congregations, people will be comfortable to talk about this because it helps. I don't know what else is a social determinant of health. Equality. Men, women made different, but unfortunately, even women made different. Some luckier, some less. And if there's making a phone call, online scheduling, hour, 2 hours, and you remove this differentiator the bad differentiator, this is wonderful. So everyone needs to know about this. Mm-hmm. And I think Fibroid Fighters, the reason is not Fibroid Foundation or anything else. I feel like women need to fight to be heard, to be helped, despite of all other difficulties. And that's what we want. We want strong women that fight and get what they need.
Absolutely. And I think that you really touched on something by mentioning churches, because faith-based education, getting into the churches, getting into the community, I think that's a really strong way to reach minority and underserved communities when it comes to their healthcare options. So thank you so much for mentioning that. It does make a difference. What are some of the, and this is a question that I'm posing to both of you, starting with you, Councilwoman Henderson, what are some of the common misconceptions people have about health initiatives in the community? How can we combat these misconceptions head on?
Well, I would say that one of the big issues or misconceptions that we have is really based in history, right? Especially in terms of communities of color in urban cities. When it comes to the medical community, decades and decades of evidence where we know that, Black and brown bodies have not necessarily been respected in terms of science and medicine. And so one of the biggest barriers that we have is really just building trust. And I think we're seeing that right now, even with the coronavirus vaccine. But even before that, if we go back into the 90s, right, trying to get people tested for HIV and STDs also took a lot of building trust, because people were scared about what that would mean, scared of whatever the outcome would be, and how that they would be viewed in the community or in society as it relates to that. So I think that trusted communicators and is one of the key things to making any type of initiative work, health initiative work, particularly in communities, getting uptake.
Absolutely. And Dr. Yan, there are a lot of misconceptions out there about uterine fibroid embolization, I think, that exist mainly because people don't know about the procedure, and also because I know for myself personally, one of my physicians specifically told me that pregnancy wasn't an option if I had UFE. So can you talk about a little bit about those misconceptions and how we can overcome them?
So that's a really strange situation going on in the healthcare community about fibroids. And victims are women. So in some specialties, advance of medicine leads to changing the way this particular specialty delivers care. For example, when I was a heart surgeon, many procedures were transitioned to cardiology, and I stopped doing this. Gynecologists, with the progress of fibroid embolization, do not do fibroid embolization. So a physician that usually take care of women's problems, they don't do the procedure. The doctors that do the procedure, we call them interventional radiologists. They do image-guided procedures. They don't have access to patients. Patients just don't go and schedule appointment. And that's why, you know, one is blind, another one's deaf, right? And there's no connection. So to solve this, we came up with the idea of USA Fibroid Centers when we bring the procedures, awareness, diagnosis to the community. Like in New York, we have about 40 centers right in the community. Bronx, Brooklyn, other places. And what we're trying to do is educate women. And as you know, diagnosis is very, very simple. It's a ultrasound, 10, 15 minutes ultrasound, and you already know whether you have problem or not. And when you connect the dots between symptoms, sign of disease, ultrasound, sometimes MRI is needed, then we can offer treatment right there, available. When we know that a treatment is possible, and it's possible to eliminate the problems and preserve the uterus, so women can bear children and eliminate #1 risk of miscarriages. That's very, very important. We've done about 4,000 uterine fibroid embolization with the less than 1.2% chance of repeated procedures. So it's almost curative, solution. That's it. You come, you get it done, and the more you do, the better you become. So if there's a studies in the centers, just do few a year, that's a one result. But when you evaluate the results of centers, they do 10 a day. Very different results. And I think it's very possible for many doctors embrace, bring it, and make it very, very, very common thing that will ensure that women have a happy life, they will be able to have a babies, and I think future generations will be enabled by this awareness and treatment that we can work together and provide.
Thank you, Dr. Yan.
Can I just?
I'd like to just. Oh, I'm sorry. Go ahead.
No, I was just going to say, to what Dr. Yan was saying. 40 million women. Like, who can think of something as that? And it's frustrating because if this were a disease that were impacting men, we would have not fixed the problem, but this procedure would be much more well known. It would be covered by insurance. It would be a seamless part. It would be studied in medical schools. It would be X, Y, and Z. And it's not just like with this, right? I mean, I feel like there's so many things where it just impacts women, or or it's more heavily prevalent amongst people of color, like sickle cell disease, right? Where if it impacted a white male, we would have had an answer for it already by now, and it would be mainstream and something that we're talking about. And so that's just something we just always have to keep in mind.
Absolutely.
Seriously, jokingly, I half agree with you. So if prostate would require major amputation, it would be illegal. So hysterectomy will be illegal. But the good news, a procedure is well known for 20 years, approved by insurances, even managed Medicaids. It's absolutely possible. So the only effort we need to make to get it in front of everyone who needs, just talk more about this, which means it's within our control. When things are impossible, when we talk about vaccine and see, will it pass FDA, will it not, what will be the result? Fortunately for uterine fibroid embolization, there's no need to talk about this. It's wonderful. We just need to talk who we can help. And it's absolutely within our control, and hysterectomy will be eliminated because if women know about the choice, if you have a headache and you know you can have the Tylenol or a removal, right, of this upper part of the body, you will choose Tylenol. So if there will be a widespread knowledge about uterus preservation option, future babies preservation option, ambulatory option when you can do it under 1 hour procedure, go home couple hours, nobody will in the right mind choose something inferior. And talking is not that difficult. We just need to work on this.
Absolutely. I'd like to talk a little bit more about the impact of fibroids and bringing awareness. Councilwoman Henderson, as you may know, Congresswoman Clark was a sponsor of the Uterine Fibroid Research and Education Act and introduced the bill to Congress in March of 2020, and Vice President Harris introduced the bill to the Senate. So with this new bill that supports fibroid and maternal health communities, how can we continue to support this bill and provide access and funding for the research and education of uterine fibroids?
Well, I think that, the legislation that Representative Clark and now Vice President Harris, championed and put forward last year needs to be reintroduced. It needs to have a hearing that's called before the relevant committees, and we need to get moving on it. And I think what individuals can do is, call your representatives. One, ask them to co-sponsor the legislation after it's been reintroduced, but two, call for a hearing to move forward on this. As Dr. Yan said, this is something we've been talking about for a long time, and we need to improve education and raise awareness, and this is one avenue to do so.
Absolutely. How do we break the silence for women who are suffering alone and change health systems that aren't providing enough of the education and providing women with the resources to make their own decisions about their body? How do we break that silence, in your opinion? Dr. Yan, I'd like to start with you.
I think the patient needs to be in charge of their health. Patients know more about their condition than many doctors. There's a saying between doctors that anamnesis, taking a history, is 80% of diagnosis. And sometimes doctors rushed, don't have time, and maybe they don't understand the significance or how often. Sometimes, as I said, doctors are people too, and they went to medical school a long time ago. Maybe they're not aware of certain things. So bringing awareness, just talking about this and changing behavior, understanding that every woman should fulfill her potential. And I think at this point, it would be useful if I'll underscore a few things. One is a physical suffering. If men would suffer, the way women suffer, things would be more understanding. But let's put it very, very seriously. Physical suffering, when someone bleeds and have anemia and always weak, and sometimes dangerous anemia. We had patients with a hemoglobin 5, 6, even 3.5. To one of the doctors, woman came, a Black woman was pale. We checked hemoglobin 3.5, sent her to emergency room. Common. Second thing, social awkwardness and limitation. Like if you need to go to bathroom every 30 minutes, tell me about happiness of your life, going to tours, going out, going to theater, and going to lectures, going to movie. Impossible. Social life is not possible. If 35% of women don't have a normal sex life because of pain, bleeding, other things, this is far from normal. They cannot have boyfriends. Things are wrong. Fibroids are number one reason for miscarriages, losing pregnancies. Terrible. And the one big thing that's maybe not really physical, but more economical is absenteeism. So fibroid disease, because of the pain and bleeding, is #1 reason for women to miss work. Majority of women are hourly employed. So if you don't go to work, I'm sorry, you don't get paid.
Mhm.
Nobody can give you 6 days, 2 weeks in a month. So how about this freedom, independence, equal opportunities, I don't know, better career, or you just think about basic survival. So happy wife, happy life. Happy women is happy community. And when we don't treat women right, when women don't have a basic things to achieve their full potential, it's all wrong. So we can talk a lot about this, and we can talk just, okay, there's a treatment. We can talk about physical problems and social and mental and family and all those things. So there's plenty of topics, and each topic, why is it good talking about this? Because there's a solution. We can easily solve it. And I think in different audience and different place, we can pick up different topics, not necessarily, nitty-gritty medical thing to discuss in every community and every setup. But I think we can find a way to make sure everyone knows about this. And our goal by July, hopefully, when, Erica, your movie will come out and many other things will happen, we'll have a very, very productive July month of fibroid awareness. And hopefully we'll be able to help really millions of women, one by one, help all 40 million women not to suffer.
Absolutely. And Councilwoman Henderson, speaking from a political advocacy standpoint, how do you think that we can break the silence and the current behavior that has been so long in minority communities about not really talking about health disparities, not really talking about the challenges that we have with healthcare?
Well, I think that's already happening. I feel like, especially over the last year, I feel like we've had more public conversations about health disparities and the issues, and disparities in health access, disparities in health outcomes, all of those different things that I feel like we've had in quite a long time. It's kind of amazing what happens when you have a public health emergency that really reaches the entire country and how it is able to change the form. I think it's really around how do you use this moment to ensure that we don't go back to being silent and not talking about these issues. And so I think we could propel it forward. I think on the national level, there are a number of, members of Congress who've been talking about this. Representative Lauren Underwood, who is from Illinois, who co-chairs the caucus around Black women's health, and they have the Momnibus legislation, which is a group of bills that are specifically designed around helping women with reproductive and maternal health care issues. And so I think it's just really, building upon this moment and pushing the drumbeat forward, but also now using this opportunity to talk about something like fibroids that haven't really been talked about in the mainstream.
Absolutely. What does quality healthcare look like? What does a society that has adequate healthcare for minority communities look like to you? If you could just kind of guess the reason why you're working so hard to build these resources, what does it look like when we have received those resources?
Well, I mean, it improves all of quality of life, but it's all tied together. One of the things that I often talk about in the district is that when we talk about healthcare, it's so often talked about in silos, when in fact, so much of it is impacting one another. We have, for instance, very high rates and a high disparity as it pertains to pediatric asthma in the District of Columbia. That's not because you didn't have healthcare. That's because your environment for which you live in is impacting your lungs. And especially when it's happening in a certain part of the city at a higher and a disproportionate rate than other parts of the city. And that part of the city is lower income, more African Americans, more industrial in terms of, we put bus barns and trash transfer stations and, all these other types of industrial things there that we don't have in wealthier parts of the community that have trees and parks and streams and just fresher air and different particles that are in the system. So to me, like the perfect system is it's really about access, so that you don't have to take 2 to 3 buses in order to get care, so that you have a doctor in your community who, excuse me, is very familiar with the environment, very familiar with the people, and folks feel like they have trust that's available. Access is wanting to go for a mental health appointment and not having to wait on a wait list for 3 months. Access is wanting to go for an evaluation for your child and not having to say, I can't get you an appointment for another 6 months, right? It really is taking care of the whole person and everyone being united in that front. It means you fill out the paperwork once, so one doctor sees what the other doctor sees, so you don't have to keep doing it 9 and 10 times. I think there's just so much work that we have to do. And it's so unfortunate, I think, that a lot of times when we talk about healthcare and the health conversation in this country, it only frames around insurance. That is a little piece of a larger puzzle in terms of not just access, but what is the quality of type of care that you're receiving? Do your doctors believe you when you come in and say, I'm in pain? Or do they question you? Or do they think that you're lying or exaggerating your level of pain or anxiety? Good quality healthcare is being able to express agency and to be heard and to receive the care, quality care, regardless of your zip code, regardless of your background, race, income, creed, whatever.
Absolutely. And that also speaks upon what Dr. Yan was mentioning before about where he decided to place his centers in neighborhood locations like the 40 locations just in New York area. Dr. Yan, what made you decide to put your centers in those more accessible areas for the community?
So I want to spell out access to 3 A's. First of all, it's availability, location, and time. Everyone is busy. If it's easy, people will use it. So if we'll bring top-notch medicine next to the people, where they live, next to transportation, accessible, that's fantastic. Everyone works, it's hard life, many responsibility. We open 7 days a week. Early hours, late hours. It's not about doctors' 9 to 5 schedule. It's about patients whenever they want. So this is first A, availability. Second is affordability. It's very important that care needs to be affordable. That means great deal of improvement. I don't want to maybe exaggerate, but basically, if you make an effort, you either buy insurance or you can apply for insurance. It is possible to get insurance, and there's many, managed Medicaids and managed care and different solutions for people that unfortunate. Just need to apply, not a big deal. So we make a point to sign up and try to take all the insurances that we can get in. Some have a closed panels, it's a different conversation. A third thing, when you have first A's, availability and affordability, is awareness. People need to know it's so cumbersome, the health system, the insurance system. People don't know what's covered, what's possible, what's the responsibility, how much it will cost. I think transparency and understanding that they can have a quality awareness, that quality healthcare right around the corner next to them, available, covered by insurance. I think it's very important, and awareness that it can make a difference for their lives. So when you go for a care that you need to take the pills, you need to check, you need to have certain obligation, and you're not sure how things will improve your life, may be difficult for some people to accept. But if they clearly understand, aware of the difference on their life, longevity, quality, very little effort will make, this awareness will make sure that availability and affordability will play a role. If there's no awareness, both availability and affordability will be idle. No, people will not use it. So I really like the passion. Councilor Hendrickson, you were talking about environment and other things. I'm trying to be very practical, things that already exist, that nothing much needs to be done, just used. If we talk about awareness and encourage people, I think will make tremendous difference, especially youth services that will tangibly improve someone's life.
I'd like to thank you, Dr. Yan. I'd like to ask you both about the things that you're doing. Dr. Yan, we know that you were doing quite a bit to help women with fibroids, but one of the initiatives that you started was the Fibroid Fighters organization, which I personally am very thankful and grateful for. Why did you feel the need to have this initiative out there for women?
Again, awareness. It's so bad, like when you know the secret and other people, and you have this burning sensation in your heart that you know how to save, you know how to help, but other people don't know how to take this message and spread around. I can't do it myself. Our doctors cannot do it themselves. We need the community. We need the people that will be able to share and enrich others by sharing the message. And I thought that Fibroid Fighters is creating Fibroid Fighters community is the way that take the secret that we know that can help millions of others and let it go and be public knowledge of everyone.
Absolutely. Councilwoman Henderson, I'd like to pose the same question to you. What initiatives are you currently involved in and spearheading or a part of to help basically open up the conversation more about the need for better healthcare in underserved and minority communities and just help in general?
Yeah, thank you for the question. So the very first bill that I introduced as council member was a bill around maternal health resources and access. It was basically designed with the issues that we had in mind here in the district where, we don't have a hospital in the eastern part of the city that provides labor and delivery services. Our only hospitals that have OB/GYN care are in some of the wealthier parts of the city that require quite a distance. And I felt like there were some other things, that we could be doing, whether it's providing Medicaid reimbursement for doula services, as the research shows that having an additional person in the room, particularly for Black and Brown women, to advocate on your behalf can help change the outcomes in terms of maternal mortality. We look for a feasibility study to have a birthing center open east of the river, which is a part of the city that doesn't have any access to labor and delivery infrastructure at this point. And then finally, providing transportation subsidies or transportation financing for women to be able to get to their prenatal and postnatal appointments. Because in the district, given where our healthcare infrastructure is located, and Dr. Yan was completely right in terms of access and availability, right? If you put it by transportation, they will come. If you have, flexible hours, people will come. Well, in the district, there are women who have to take 2 and 3 buses just to get to a prenatal appointment, and you have to pay for that. And if you're having to make a decision between going to a doctor's appointment versus paying rent or buying food for your family in that moment, we just have so many women who are skipping it. Lots of women in our city are not seeking maternal care until their 2nd and 3rd trimester, which really makes it really difficult to catch some of the issues that could be wrong. Whether it be, are you developing diabetes? Are you, is there something that's going on that, it can be medically addressed very early on in your pregnancy. And so that's really what I've been focused on. That's only one part of the scope. There's a lot more work that needs to be done in terms of improving access and availability of health services in the district. And that's what I've been working on.
That's wonderful. Absolutely wonderful. And speaking from it'd be beautiful to have that locally available too, just have that local support, knowing that people are being made aware of what's available in their neighborhood already if they don't know what's available, letting them know and inviting them to, the different resources that they have. But of course, you're on a grander scale championing for people in DC. So, you know, it's going to start there and hopefully trickle down to the local level to help more women and help more families get better health care. So I just wanted to thank both of you for the conversation. I believe that this is one of many, many conversations that we can have to, you know, break the silence, change the behavior of the way that our country as a whole has been handling healthcare for minority communities, and hopefully save some lives in the process and save some uteruses, Dr. Yan. So thank you both for the conversation. Dr. Yan, did you have any closing statements?
Yes, I have to go and visit Councilor Henderson because, I just want to underscore, naming the problem is a 50% of the solution. When you describe deficiency of maternal care in the capital of the richest country on earth, it speaks volumes. And just hearing about this already make, you know, brain work how to make things better. And I think, thank you both for your passion, and I hope together we'll bring awareness and enable women wonderful and happy life. Thank you very much.
Absolutely. Thank you so much, Dr. Yan, and thank you, Councilwoman Henderson, for your time and all of your efforts in Washington and everything that you're doing to better this world for everyone.
Thank you
so much for having me.